Hi, Mr. Mancini. My name's Claire. I'm a level 2 MOMAC nursing student. Can you tell me your full name? Thank you, and I'm just gonna check your wristband. Perfect. So today we're gonna be putting a catheter in you. This is because you have 630 milliliters of urine in your bladder and you haven't been able to go to the bathroom for the last 8 hours. So we're gonna put a catheter in and relieve some of that uncomfortableness for you. Covers now, and I'm going to drape the patient now. So first what I'm going to do is put hand sanitizer on and put on some clean gloves. I'm then going to open up the kit, and I'm going to take everything out of the kit just to get organized. Okay. I'm also going to put the catheter in my container. So I'm just going to open up the outside. And dump it in. Yeah, okay, so the patient is in a supine position with the legs spread slightly apart. This is just the easiest way to drape the patient and insert the catheter. So I'm gonna put a drape between the legs now, and I'm gonna keep it sterile, so I'm only gonna grab the edges of it, and I'm just gonna put it between the legs. Like that. Yep. Okay, so now I'm gonna clean the peri area just so that we can make it clean before we insert the catheter, and this just minimizes risks for infection. So I'm gonna pour the saline or sterile solution into the container. And this is garbage now. And I'm going to bring it between the patient's legs. Okay, so I'm gonna clean the penis now. So I'm gonna take the sterile solution soaked cotton ball, clean around the base, and throw that one out. And one around the tip. Okay, I'm going to take off my clean gloves now and put on my sterile gloves. So I'm gonna perform hand hygiene again and put on the sterile gloves. Okay, so I have my sterile gloves on now, so I'm free to touch everything. This is also sterile field too, but I'm not going to use that. So I'm going to take this drape and put it over the patient. Just like that. I'm going to take my kit and put it between the legs. I can take off the blue part. And this is garbage now. So what I have to do now is test the integrity of the catheter. So I'm gonna take 10 milliliters of sterile water and put it into the balloon to make sure it doesn't pop or break. So I'm going to put it into the end here and fill the balloon all the way up. So as you can see, the balloon is filled, it's not breaking or anything, so it's good to use. So I'm just gonna take the water out now. And I am I'm ready to insert the catheter. So I'm gonna open this and pour it out and dip the catheter in it. And now we're ready to insert it. So I'm going to put the end of the catheter in here just so it catches any urine that comes out once I get the catheter into the bladder. So once I touch the penis, this hand won't be sterile anymore. So I'm just gonna take it and slowly insert the catheter in. All the way to the end. So I have urine coming out of the catheter, so I know it's in the bladder. So now I'm gonna fill the balloon up. So I'll take my water again. And fill the balloon all the way up. Okay, now that the balloon is filled, I'm just gonna tug on the catheter slightly until I feel some resistance. And that's how I know that it's at the edge of the bladder. Okay, so now that the catheter is in, we're gonna put it into a drainage bag so it has somewhere to go, so the urine has somewhere to go. So you just take the end of the catheter and insert it on the end here. And push it as far as it can go so that it's on all the way, nice and tight. Okay, so it's been 36 hours, so we're gonna take the catheter out now. So first we have to deflate the balloon. I'm just gonna leave it attached to the catheter bag for now. So I'm gonna take a an empty syringe, 10 milliliter syringe, and make sure that I take out all the water that's in there. So I'm just gonna attach it here and slowly pull it out. Okay. So I want to make sure I have the full 10 milliliters, which I do. So I know the balloon is empty. So I'm just gonna put a towel underneath him to catch any urine that falls out when I pull the catheter out. So I'm gonna pull it out fairly quickly. I don't want to pull it out too slowly. So on the count of 3, I'm gonna pull it out, okay? 1, 2, 3. Okay, so I still have a full catheter bag here, so I could measure it if I needed to. Otherwise, you would just empty it into the toilet, and all of this would be garbage. Okay, I'm now gonna wash my hands with soap and water. This is just a more effective way of cleaning my hands than hand sanitizer, just in case I came in contact with any urine or anything else that was in the peri area.